Okay, so we're gonna do a myotomal circuit for Travis here. I have a patient who I treat this way, but Travis is just gonna be that stand-in for them. So for their lumbar area, and these shorts just aren't staying, so I apologize.
No, you're good.
Going down. So we're gonna do the left L5S1 multifidi. They originate off of the PSIS, the sacrum, and then the mammillary bodies, and then they attach on the either 1 to 4 levels of that spinous process above. So, and then they're innervated by the medial dorsal branch of that spinal segment. We're just palpating here. So we want to find his PSIS, and then we can come in and feel those spinous processes and go ahead and do an anterior pelvic tilt for me, and then the other way. There we go. Good. And then relax. So there we've got that 5 and then that sacrum. So we're going to find that spinous process. We're going to hook over, and we can kind of feel that gutter. And for Travis, we're going to use 60s. And what we need to be aware of is how wide that lamina is. And it's going to be about the same width as, I don't think I tapped it in enough. It's going to be the same width as the person's fingers. And we just need to be aware of what's on the other side of that. There we go. And you're going to go just straight down with a slight medial glide, and then we're going to be just right on bone, right on that lamina there. The multifidi cause extension when contracting together, and then ipsilateral flexion and contralateral rotation when acting separate. Okay, so we're going to come down and we're going to place one on that S1. And again, we're going to go down until we hit bone. How you doing?
Good.
Good. Okay, I'll hook that up when I come to the other side. So for my patient, they've got a lot of significant tightness in their hamstring. And right now we're working on that biceps femoris. So it attaches on that ischial tuberosity, and then the long head attaches on the ischial tuberosity, and then the short head attaches on the lateral linea aspera, and then they both come down and attach on that fibular tendon. Okay. So again, we're going to palpate. We're going to find that butt bone. Okay, that ischial tuberosity, and then we're going to come down. Okay. And then we're going to kind of feel in here for that separation between that vastus lateralis, because it does hook around quite a bit. And we're going to find that biceps femoris muscle belly. Any of this tender on you, by the way?
Not bad.
Okay. So we'll place 2 needles here. And we're going to use 70s, just so I have enough that sticks up to grab onto the alligator clip. All right. So I use like a bracket approach, so I can just put more compression through the rest of the thigh versus like a grasp. So we're going to go posterior to anterior with a slight lateral direction. We want to avoid that sciatic nerve, which goes right down the middle. And then the biceps femoris is supplied by the fibular and tibial portion of that sciatic nerve for the short head and the long head, respectively. Here we go. And there won't be a bony backdrop for this. Okay, and we're gonna hook him up. The biceps femoris cause knee flexion and lateral rotation, and then hip extension and lateral rotation. Doing okay?
Mm-hmm.
All right. So we're gonna turn up the back first. You tell me when should be comfortable. So I've got the frequency at about 10 here.
That's pretty good.
Okay, strong but comfortable.
Yep.
Okay. And then the hamstring here.
Doing about there.
Okay. All right, so now for my patient that I usually treat, we do this for about 10 minutes as time allows, but we're not going to do that for this video. So, all right, thank you.